Hi everyone, I'm Maimah, president and founder of the Tigerlily Foundation and a 14-year survivor of triple negative breast cancer. Today I'm so honored to bring you Breathe TV, a space to connect with other survivors, advocates, women going through the breast cancer journey, and to exhale throughout that process. We have four amazing women who are dynamic in each one of their own individual rights. We have Ines Rodriguez, who is a survivor and clinical nurse educator. We have angel advocates Tori Gieb and Nadia Smith, beautiful advocates who will share their journey and their experiences with you. And we have Edwina Lantigua, who is also a patient mentor who will be sharing her journey as well. Hi ladies, how are you doing today? Thanks for being here. Thanks for being here. Nadia, I'll start with you. You have an amazing journey. You are an early stage breast cancer survivor. Tell me about your story and how your journey manifested and what you've learned.
At the age of 33 in 2016, I was diagnosed with ductal carcinoma in situ. So totally shocked because I was, fairly healthy. I was diagnosed 6 days after running a personal best and a half marathon with no family history. Breast cancer wasn't a part of my world. It wasn't something that was talked about in my community. So I had to learn a lot during this journey. After about 2 years of kind of dealing with it, learning everything about breast cancer, I finally found communities that were geared toward young survivors, women of color. I felt very isolated in all of the waiting rooms for the doctors. No one looked like me. I was perceived to be a caregiver. I didn't feel like I had any support. I felt very isolated. And that led me where I am today. So I went from getting through the day to day of being a survivor to being a thriver, like making sure that other young women don't feel like me along that journey.
People weren't talking about breast cancer in your community. Community meaning black community or where you live. Can you share more about what that meant?
When I say community, I mean the Black community. So, one of the things that I found very prominent in the Black community was we don't talk about our family health. I found my lump. I went to a primary care physician and I said, this is something that's a little strange to me. I was very healthy, so I didn't feel ill or anything. I was referred for a mammogram, inconclusive. Let's come back 6 months later. I went back again for a mammogram and basically had to keep pushing for a surgical biopsy before I was ultimately diagnosed. I was asked a lot of questions about my family history. And even myself, I wondered, do I know enough? I didn't know of anyone in my family with breast cancer, but it really made me question, what do I really know about my family health history? Because it's not talked about. In the Black community, when someone has cancer or a serious illness, you just say, well, they're sick. Well, what does that mean? And how does that impact future generations by not understanding and knowing the risks that we're exposed to genetically?
That's very true. Being myself African American and African, we didn't discuss certain things growing up. People would just die and they say, so Auntie so and so died. And that was that. And you didn't understand what they died from. And I wonder how many people have died who are of color that don't understand what caused that death, that disease. That's really powerful to take home with us as we're watching this right now. You mentioned that you were also perceived as a caregiver. Why was that?
So I was just perceived because I was young and because I was fairly healthy. This couldn't be happening to me. And that's how it's perceived. When you see marketing campaigns and a lot of the information about in the pamphlets, pictures, you see older women portrayed. You don't see young women. You definitely don't see young women of color. So it's perceived to be a disease that doesn't impact us, and that's so not true based on the statistics that we see that Black women are dying faster, from this disease, but you don't see us. I felt alone, and I also felt that my story wasn't important because I wasn't sick. So, if I don't have any signs of fighting this illness, no one wants to know what's going on with me, or I'm just perceived as you're okay, you'll be fine. So I didn't have that level of care or support because I wasn't perceived as being sick.
We're fighting for our lives, and we want to look normal. We want to look like we're a young woman that's living her best life, but dealing with cancer, which is a really tough place to be in. You talked about also when we in your pre-interview about feeling a body disconnection and not feeling like you were sexy anymore. And I know that you mentioned earlier going into the room with your compression garments on and your cute pants and looking good. Tell me what that felt like for you and how did you get that back? Because you look fabulous right now.
I went into it thinking like there's a life after this diagnosis. So I had to condition my medical team to treat me that way. And a part of that was considering a lot of things that most older survivors won't have to consider, which is having children or, how do I feel about dating? And so I did have, of course, those body changes. I had a bilateral mastectomy. which I look down and I see scars. You have the weight fluctuation because of the change in activity as you recover from the different procedures. The number one thing was the comparison of the before. This is what I looked like before. This is what I could do before. So that was kind of robbing my joy, comparing what I was able to do before to the present, and kind of accepting the body as it was, which meant throwing out some of those old bras. I literally had to go in and throw out some of those old things and start to try to find new things that were comfortable for me. So new bralettes, or, new pieces of clothing that were comfortable. So it was accepting that new body, and then accepting that this is the new. I may not look the way I did before, or my body may look a little different, but this is a part of my new normal. And ultimately I became proud of those scars that I wanted to hide.
That's so beautiful. I think that's one thing that breast cancer has given us all, whatever your staging is that sense of going from being afraid and not knowing where your true strength lies, and then realizing that you're a phoenix and that you're fearless. Thank you so much, India. I wanted to ask a couple more questions. Were you ever asked about your fertility and egg harvesting or genetics, things like that, or clinical trials?
I was single, I was unwed, and I didn't have any children. So at the age of 33, it was still an option for me. In my world, it was still very much an option. So I did go through with egg harvesting, which I know that I spoke to several survivors that weren't offered that opportunity, for family planning. So I did have some talks about family planning, but not as much about clinical trials. I weren't offered any opportunities to participate in clinical trials, which for me, being a person that education is a coping mechanism, that would have been an awesome opportunity.
Many doctors don't discuss fertility, but you had that option, which was wonderful. Are there things you wish you had been told about during your journey? I know you mentioned just now clinical trials. And Black women have a higher mortality rate because we don't have the right treatments that have been tailored for our bodies, because we're not asked oftentimes to be a part of a trial. What do you wish you had known going back, if you could do it again, that you would have asked for going through your breast cancer journey?
I wish I would have known the statistics around the early onset, around the numbers of young women that were impacted by this disease. I went in blind thinking what most people think, this is a disease for older white women. And I had no clue that young women were being impacted by this disease. And also, I wish I would have known more about the mental impacts of the disease, unpacking what happens to you emotionally, spiritually, and mentally once you've received that diagnosis.
Yeah, and I think that's where we're going with Breathe. It's just that we want people to have a space as a patient, as a person, not a patient, a person's first, to be able to exhale throughout their journey. And we can't forget that we're people and that we are operating in a heart space, that even though you're a patient when you get diagnosed, that you're a person that has emotions and needs spiritually, emotionally, mentally, and all these things that make you a human being. And so it's really important to have that support structure. So thank you for your insights and your input. And you are beautiful, you are strong, and I can tell you're a fearless young woman. Thanks for being with us today. I'm going to turn to a dear friend of mine, Tori Gieb, who is an amazing NBC thriver. Tori, I know your story pretty well, but those who are watching and meeting you for the first time, share with me more about who is Tori Gieb, where you hail from, and what is your journey?
I was diagnosed metastatic de novo at the age of 30, which means that I was diagnosed from the beginning of my treatment with metastatic breast cancer. I've never known early stage breast cancer. When I was diagnosed, it had already gone to my bones, my lungs, and my liver. I had actually been misdiagnosed for a year and told that I was too young for breast cancer. I was having back pain. They did a CT, saw lesions all down my spine. And it even said on the bottom of the report, which I didn't see for a year, that it should be followed up with an MRI. The only thing at the time that I heard was from my doctor, who said, it's fine, you're fine. It might be some fibromyalgia that's causing your pain, or it could be autoimmune, but it's nothing, you're fine. So I believed my doctor. We're socialized to trust our doctors and believe our doctors and to not question authority. That small lesion in the middle of my back ended up being a 70% compression fracture on that same bone. And it had also gone at that point to my lungs and my liver. So it was very devastating to hear that it had, silently spread through my body. And I knew that my grandmother had breast cancer back in the 90s, but it was never really talked about. In my family, it was always very hush. It was, yes, she dealt with it, but she dealt with it privately. She dealt with it quietly. And if we brought it up, it was, well, we don't talk about that. That's grandma's business. We don't talk about that. As of now, I've been living with metastatic breast cancer for almost 5 years. We did find in May of this past year that it has also metastasized to my brain. I've had radiation on 8 different parts of my body, including my brain now twice. And I've had multiple surgeries over the last 5 years. So I look at it in a way that, I just hit my 5th Christmas with metastatic breast cancer. But when you look at the odds and the fact that less than 25% of the people that I was diagnosed with that had metastatic breast cancer are still alive today, and that number is only going down. We really need more. We need more research. We need more resources. We need more medications. And all around, we need public policy that supports these things to make sure that we can have access to care. And that's really become kind of my passion over the last 3 years, is really working in that public policy space and also working with people of faith. Growing up as an evangelical Christian, we didn't talk about breast cancer in church. If we talked about cancer, it was because we were praying for somebody and then we dismissed it at the end of the prayer. We didn't really talk much about it. We never asked how we can pray for that person. We just said, we're going to pray for this person. Talking to faith communities and making sure they know their risks, making sure that things are done in their comfort level as well, even from a support end. That's really been a large area of my advocacy and my passion.
So I'm trying to fight back tears. So for those of you watching, Tori's my heart. I adore you so much in so many ways, and you exude everything that I aspire to be. You're a woman of faith. You have a heart that's so big and so pure. You tell it like it is, and you use your experience to help others to change their outcome. You've been your biggest advocate throughout this entire process. If you were to talk to a patient right now who's early stage about reading her path report, getting follow-up opinions, what would you say? Because there are things on that report that if you'd known what to do with that information, you may have not had to have 9 treatments and be fighting for your life right now.
I think that one thing that I was really afraid to do in the beginning was question my doctor, because we see them so much as an authority and we don't want to question that authority. I was always taught, what the doctor says goes. They've had more education than I do. They know the medical field, because when we're afraid to question things, when we think that they're the ultimate authority, then seeing a second opinion for me at the beginning of my treatment felt like a betrayal to my provider. For me, it felt like I was saying, I don't trust you. And that's not what it was. It's not that I don't trust them as a person, but at the same time, I just want to double check. I want to talk about this as a conversation, because at the end of the day, it's about your life and about your health. And one person could be wrong. And, nobody knows everything. So even getting that second opinion just to clarify or to make sure that people are on the same track, I think there's something that's so valuable in that so many of us have just been conditioned to not do, or not question, or not ask, or even just basic things. Like if you get a scan, say, can I have a copy of that report? And if they say why, just say, I just like to have a copy of it for my records. When I had that first scan, I never saw a scan report, and nor would I have ever thought to ask for one. It wasn't until I had my first scan at a comprehensive cancer center that was an hour away that I went into the doctor's appointment. They handed me a piece of paper that had my scan on it. I'm like, oh, they can do this. They can print that out and give it to me. I'm trusted with this information. It wasn't until I had that I realized you could even do that, or that I could see that. And when I saw on the bottom of that first scan that I had on the bottom, compared to previous year metastatic study, and I'm like, what do you mean previous year metastatic study? And that's what kind of got me into that wormhole of looking at my old scans and seeing that there were things that were missed. And I never knew to ask for that piece of paper, or that piece of paper could even be given to me. Knowing that talking to another doctor is not a betrayal of your doctor. You're not going to get less quality of care from your doctor because you seek a second opinion. I think that's another thing people worry about, is if I question my doctor, am I still going to get that same quality of care because now they think that I don't trust them? And know that that's not the case. First oncologist I saw, she said, do you want to get a second opinion? And I was kind of taken back. I'm like, well, no, I trust you. And she said, well, that's not what a second opinion's about. It's just to, make sure that we're on the right path. But had I not been told that, I probably would still be afraid to get a second opinion today on any of my treatments.
I totally get that because your healthcare team is going to be your team for life. Whether or not you're, early stage or Mets, that's going to be your team that's got your back for the rest of your freaking life. So you have to make sure you're picking the right team. Number two, would you buy a car without getting, the car inspected? Like you're buying a car or a house, your body is more important than all those things. You have to make sure you're picking the right team that understands you, but also that the team that cares for you, that you trust. The first doctor I saw and told me to cut my breast off right away. He just said, cut him off. He didn't look me in the eye. He just said, cut him off. And I sat there stunned. Like, how could you talk to me like that? The next doctor I went to, I sat in the chair. I was so afraid. I was sitting there curled up and shaking like a leaf. And she walked in there. She looked at me, took a deep breath, and she said, breathe. I want you to breathe with me. And she breathed with me. And she got the chair, pulled the chair close to me, and she just held my hands. And she sat with me. Even now, talking about it, I get emotional because she looked me in the eye and she held me like a person. She touched my flesh. Because when you have the diagnosis, you have this body disconnect, right? Your body's now betrayed you in some way that you didn't know about. And you want to still feel like you're here and that you're human. You mentioned earlier that you are very religious. Based on your faith and how in depth you are with that, how has that affected your treatment journey as well?
I feel like it's kind of been a twofold thing. When it comes to the actual, when I was first diagnosed, you kind of saw a mixed reaction in my family, kind of dependent on their theology. So for me as an evangelical Christian, one thing that I don't subscribe to in my faith is prosperity gospel teachings. And there are people in my world and in my family that do subscribe to a prosperity gospel teaching. In prosperity gospel, for those who don't know, it's the idea that nothing bad will harm you or happen to you if your faith is strong enough. And when you look at the actual teachings of the Bible, that's not biblical. Everyone went through trials, everyone went through tribulations. No one will go through this world without pain or some type of ailment. And so for me, looking at things with prosperity gospel, it just felt very disingenuous to me. So it kind of made me hold more firm in my faith. For me personally, the spots where I found the biggest disconnects with my faith have been in the support arena. We don't talk about breast cancer in church. We talk about healing, but we don't talk about what we're being healed from. In some congregations, mental health is a lack of faith. And what we know is, mental health isn't a lack of faith, it's a lack of chemicals. My faith is not diminished because I'm depressed. My faith is not diminished because I have anxiety. In the Bible, it talks a lot about have no fear, but at the same time, it always tells you why not to have fear. When David went to confront Goliath, he was afraid, but Goliath was huge and he was a kid. So when we have something real in our faces, what does that look like and how does that mold our faith? Because I think for a lot of women too, or men that are dealing with this disease, this might be their first crisis of their faith that they've ever dealt with. They might have had a great relationship with Christ. And then when they have this diagnosis, they're like, well, God, I was faithful to you. I did all these things. Why is this happening to me? And that goes back to what I said before about that teaching of the prosperity gospel is we're not promised that we will never have pain in this life. We're not promised that our health will always be insured. So I think that looking at those faith perspectives and really supporting women of faith and giving them a place to go to talk about these issues where they don't have to be afraid to talk about their doubt or talk about their fears is so critical because we don't have that.
Yeah. And you can be afraid and still walk through your fears. That's what makes you fearless, right? It's walking through that fire anyway. And that's one thing I really admire about you. When we talked earlier this year, you'd had multiple fractures. And you mentioned about 4 to 5 things that were happening in your body at that time and the extreme pain that you were in. But you were still smiling. And, you know, as your friend and as a survivor who knows what you deal with, I find your faith to be so, like, so humbling. So I really want to talk about this because we don't discuss faith enough and spirituality enough. When we talk about healing, we talk about healing as in I'm going to heal and be better physically. But I believe that healing could be that spiritual healing. For example, the healing that I received through God in my life, through the work I'm doing, I feel like I'm on a different level of existence right now because the faith I had before breast cancer is not what I have now. The healing that's come for me in this lifetime, in my soul, in my spirit, in my aura, in my energy, is just so deep, it's so profound. I love a poem by this poet called Rumi. He says the wound is where the light enters. And so I found that, you know, when I got those wounds, I got the cuts, I had to lose a lot of myself. I learned that to let the wounds be wounds, but let the light enter and transform me as a person, mind, body, and spirit. And so the true thing for me is that fear to fearlessness really means embracing the wounds, embracing your faith, embracing your true heart and soul and all that you are, and breaking open into a new person, right, throughout your breast cancer journey. So I want to turn next to Ines Rodriguez, who's a survivor of breast cancer and a clinical nurse educator. Ines, thanks for being here today. How are you?
I'm amazed to be here and very grateful for this opportunity.
Thank you. So as a clinical nurse educator, you meet patients all the time. There's some things that people don't often tell patients when they're going into that room. So what are some of the top 3 things that patients should know about going to that first doctor appointment with their oncologist, surgeon, or radiologist?
Yeah, I never thought I would see myself in this role. I was a pediatric oncology nurse 19 years ago when I got diagnosed with breast cancer. And it just was such a learning experience because even as an oncology nurse, there was so much fear and just such a need to understand this disease. So I've been really lucky to have a role now as a clinical nurse educator at Puma because it feeds my passion. And my passion has been to empower other women diagnosed with breast cancer to understand their disease, to understand their treatment options, to understand their risk of recurring with the disease. So I get to do every single day something that is significant and meaningful in my own life. You know, the day of my mastectomy, my aunts walked around and it looked like they were at a funeral. And I looked around and I said, oh no, this is not my reality. So I had my sister help me put on some makeup and bright red lipstick, and I played my disco music at the highest level that the hospital would allow. And I threw a party in my room because I was not going to mourn the loss of my breast. I was going to celebrate the rest of my life. And that is the message that I have for every single woman diagnosed with breast cancer. This is not the end. This does not define you. This is just a bump in the road. And you now have, all of these resources, Tigerlily and what you're providing here is so important. As an oncology nurse, I see the disparities. I see the misinformation, but I lived it. So I came out bold and strong and really have changed the way my family sees this disease, and have tried to change in every time that I talk to any patient that is Hispanic, Latina, to realize that we owe it to everyone in our family to change the misconception and the taboos and the miscommunication. We need to teach our daughters that it's okay, that we, know ourselves, know our breasts, be able to say these words openly and change the culture. Every time I talk to my patients, if they're younger, I say, you now have to get your mom and your grandma in here, to stop dying because of ignorance. If I had patients that were Haitian, I could not communicate in Creole, but if I knew that they were not understanding, I would definitely bring in, a medical translator, because we have got to meet our patients where they're at. And we have also got to have to provide information in their language. You know how overwhelming it is Maimah, when you're diagnosed, you probably keep, a tiny percentage of what someone's telling you. But if we can empower them by giving them information they can take back with them and digest in their own language, in their own time, that's imperative. Those are things that we really have to work to make happen for anyone with any type of cancer. But for me, my passion is breast, so that's what I try to do. It's a privilege. I have met so many women that have just, blessed my life with their grace, their courage, their dignity. It really is. We give you so little in return for all that you give to us. So it's a beautiful relationship. And I think that every single day I wake up and every time I sign RN after my name, I still get a little, shot of joy through my heart. And I love what I'm doing right now because I, talk to patients. We do patient webinars to educate. I get to talk to providers, nurses, nurse practitioners, and any way that we can decrease the fear here by providing information is going to help us, conquer that enemy that's trying to hurt us. So that's my life, and I'm very privileged. I think I'm blessed to do what I do. What I want is to understand your breast cancer. Don't listen to your Aunt Ruth's, stories or your friend. Focus on this journey that is yours. Understand your pathology report, what drives your cancer, what are your treatment options. And if you don't understand when someone's talking to them, stop them. When someone's giving you education, stop them and say, I really don't understand. Because knowledge in this case is so powerful, right? And that is what you're trying to do, impart knowledge so people decrease fear. That's my job too. So I would tell the newly diagnosed women, and I've said this to so many, do not let the fear take over. Let your hope, let your faith and knowledge guide you, and seek people that can enrich that knowledge and help you through this journey.
For those who are watching who are new to the breast cancer space or who are newly diagnosed patients, talk about different breast cancer subtypes and what that means. Because to Tori's point earlier, you get this report and you're like, what is this? So what are the subtypes and what do they mean for those who are new to this space?
You have breast cancers that are sensitive to hormones. It doesn't mean that you're producing more hormones in your body. No, it just means that this particular type of breast cancer is using estrogen and progesterone that women produce to increase growth. So in your treatment, you're going to want to block those hormones, right? That's really important. You're going to want to know if your breast cancer is sensitive to HER2, which is human epidermal growth factor. It's a mouthful. And this is a protein that, again, we all have, but there are cancers that have more of it. So the treatment for this type of cancer is different. There's a great treatment planning guide that Tigerlily's working with, and I really want every woman to go into their treatment, their first appointment, with this in hand, because that has a lot of explanation of what you need to know so that you can better plan your treatment and plan how to vanquish this cancer.
Thank you. Tell me a bit about also understanding the difference between the grade of your cancer and the stage of your cancer, because many people are confused about that as well. I know I was.
Okay, so when we're talking about grade, it's literally looking, when the pathologist looks under the microscope at this particular cancer cell. Like I had said before, we're looking at how far from normal has this cancer cell evolved. So grade 1, it's still looking more normal. Grade 2, it's less. And then when you're getting to breast cancer that's completely, that cell looks nothing like normal, that's a grade 3. So that's looking at the actual cancer cell. Now, stages takes a lot of things into consideration. It takes into consideration the size of the tumor. And I'm not a numbers person, I'm a visual person, and I would tell my patients, are we looking at a breast cancer of the size of a pea? Is it the size of a grape? Is it the size of a plum? Are there lymph nodes involved? The lymph nodes are very important to understand if that's lymph node involvement. And These two things together give us a better picture of what type of breast cancer your individual diagnosis is. Seek information from credible sources. Do not go just into the internet and any kind of link, American Cancer Society, breastcancer.org, Tigerlily. Look for credible sources. Find that person in your team. Find the one that is going to listen to you. And if you don't find it, demand it. Demand your doctor takes time with you. We take more time, buying a car than we sometimes do understanding our breast cancer diagnosis.
One of the things we're doing at Tigerlily is creating these patient guides to help patients go into the doctor's offices or treatment centers with the right information, the right ammunition, and to be empowered to ask the right kind of questions. I want to turn to Tori. You lived in a rural community, you still live in a rural community. Are these kinds of services offered to you in those kind of communities where you're maybe 10, 20, 30 miles from a major comprehensive center for cancer care?
We don't have an oncologist in my county. In fact, the closest county that has an oncologist is 2 counties away. I really think it's sad that your zip code dictates your care a lot of times, but that's the reality of it. And there are some people too that, whether it be in my county or whether it be in Appalachia area of Ohio, that are just too poor to go to treatment. Like, they don't have a vehicle to drive 60 miles to go to treatment. And we don't have Uber in my town, and we don't have public transit. So it's not as easy as, if I lived in the city, that I could, take a city bus or take an Uber to the cancer center. That doesn't exist. I'm lucky that I live with my family, and my family can help me out going back and forth to treatments when I can. But I think about those people who either don't have a vehicle or, we have a large Amish population in my county. Like, what happens if they get breast cancer? We don't have mobile mammography that comes out into rural areas anymore in Ohio. That program was discontinued. So to think that I found a lump and potentially have to wait 2 weeks to get that image, and then wait another 2 weeks to get a biopsy, and then wait another 2 weeks to get the result of that biopsy. Now we've already spent a month and a half just to get that initial diagnosis. People at a comprehensive cancer center or, that have access in their town to go and do these things might have an answer in 48, 72 hours. It could be 6 weeks for a person in a rural community. When it comes to access to care, I think that's the biggest differentiation between those of us in rural areas compared to those who live in cities.
Yeah, you mentioned multiple barriers. You mentioned that the path report, you weren't told the right information. You live far from where the biggest centers are. There's no oncologist in your community. Those are things that shouldn't have to happen to anybody. I want to ask Nadia, as a young Black woman, I know that women of color, brown and Black women, face multiple barriers to care and multiple health disparities. Are there things that you faced in your journey that you found to be inequitable? And if so, how are you working to end disparities in your lifetime?
As a woman of color, my concerns weren't taken seriously. That was one of the main things when I went, initially. This is something that's bothering me. Even, getting that initial mammogram and the follow-up mammogram, it was a fight with insurance because I was healthy, but I just didn't feel like I was being taken seriously. So one of the things that I want to do is make sure that first educate our community to show. So my face, me speaking of this disease is step one. So being bold enough at one time, I didn't want to talk about it, and that I was conditioned because, of what's happening in our community not to talk about it. So I want to go back into our community to educate of how this is impacting the Black community, which is one thing, and also train or, recruit other advocates, to help speak for us and to spread the information, which also means that we're demanding those screenings that aren't available in our community. So we have more resources and more access because we now know that this is impacting us and we need to have the proper health care to understand our risk.
Thank you. Back to Ines, as a nurse navigator, we're seeing people who are Black and brown have disproportionate impacts from COVID-19. There's rural issues, there's financial barriers, there's the color of your skin, there's not knowing what to ask. What have you seen in terms of the impact of COVID-19 on Black and brown people?
It's really, frankly, scary. right now because we have women who are not getting mammograms that should be getting mammograms because many centers stopped doing things that were non-essential, right? That was one part. The second part is, frankly, people were afraid of going to get, women were afraid of being exposed in hospitals. I worry about those people that are marginalized or, to healthcare. Also, there's just lack of community because we're not seeing each other, right? A lot of patients are being have telehealth now or are having conversations or are not going as frequently into the hospitals or into the cancer centers. That's concerning to me because I think things can be missed. It's just an overwhelming situation that really needs this type of conversation. We need to take care of each other and reach out to those people that, or these women that may be sitting at home, nursing alone, not thinking they can get care. That's my greatest concern in this time of COVID.
COVID began in around March, and you've seen the screenings have dipped significantly, and so we're going to start seeing that uptick. We're seeing that now. We have to start to address that. Thank you for that, Ines. I want to bring on Edwina, who is a patient mentor. Edwina, thanks for being with us today, and tell us about your role as a patient mentor and how do you help patients prepare for the breast cancer journey?
Everybody's going to react different to treatment, but in general, the side effects of treatment are pretty strong, and nothing can prepare you for it. I mean, you go in like hoping that if you're going to be one of those people with like the least amount of side effects, but you don't know what is going to happen, and so it's really, really, really scary. And many times those side effects prevent women from, completing treatment or beginning treatment even. In my experience, side effects do get better, or if they don't get better, you learn how to manage your side effects. And your doctors if you communicate with your doctor is always going to be there to help you manage those side effects a little better. Your nurse is going to help you. I think it's your nurse navigator. It's gonna help you find like a way to feel better. I'm Mexican, and in Mexico we don't talk about cancer. You just don't, because in Mexico cancer is if you get cancer you die. That's what people think. So a lot of times these women don't know how to communicate with their doctors. I have found in my journey as a mentor that a lot of times these women don't have a relationship with their doctors, and they're just like following, they're just like getting stuff done without like asking, questioning, reading. Women need to hear stories of young women who got cancer when they were in their 20s. Women need to hear stories of women like myself who, I didn't have children and I was 39 and I was planning on maybe starting a family. Nobody told me that I needed to touch my breasts, growing up. Like nobody taught me that. Nobody told me that you needed to make sure that everything seemed okay.
Nadia, what was your experience with selecting your treatment options?
For me, there were three main criteria when I was, evaluating all the treatment options. Well, first of all, what I valued, my personal values, the toxicity that was explained with the treatment, and also my quality of life. So take, for instance, when we discussed tamoxifen. My decision was to decline tamoxifen, after speaking with my oncologist, how would it decrease my risk of reoccurrence, by taking this medication for 5 to 10 years. And after our discussion, she said, 0.5%. Well, for me, the side effects of taking that medication for the extended period of time, with the value of wanting to have a family and still have my active lifestyle that I had prior to diagnosis, a combination of those different things led to my decision to decline tamoxifen. So with any treatment, I evaluated what my diagnosis was, being estrogen and progesterone positive. Okay, so what does that mean for me? And when taking this medication, what's the level of toxicity? How will it impact my body? But it's all about, what's best for you. there is a standard of care, but we discussed early in the conversation being a young, being diagnosed young with early stage. I feel like, you have to find those things that line up with what you want for your future, because life happens after this diagnosis. Life happens after treatment. So what treatment will give you that best quality of life?
Right. So being an early stager, your treatment's going to come to an end. You had a finite beginning and end for your treatment journey. And that's empowering when you're an early stager. For Tori, who is metastatic, it's a whole different ballgame because you're looking at different treatments for stage 4 breast cancer, and those would change over time. How do you pick the right treatment and know what's coming out with clinical trials and all of that?
The idea that, removing that breast tumor was no longer going to affect how long I lived or what my cancer did was a very, very difficult thing to get my mind around. I would just like, I just want this out of me. It almost felt dirty. Like once you know that it's there and you can feel it, it's like something that you don't want there anymore. And knowing that that wasn't going to happen, I was just like, well, okay, well, what's next? I'm going to go ahead and do chemo, right? Because I just had my port put in. No, you're not going to do chemo now. And I'm like, well, what the hell am I going to do? Like, are you guys giving up on me? Like, what is going on? And at the time, my doctor said, we have this treatment and we need you to understand that, metastatic breast cancer, you're going to be in treatment for the rest of your life. And I had no idea that metastatic breast cancer was a terminal diagnosis. We want to treat it like a chronic diagnosis as much as possible. But the fact that almost 75% of the people who are diagnosed with metastatic breast cancer aren't alive in 5 years means we can't call it chronic yet. It's a terminal diagnosis. And the way that we treat it is we're on a treatment as long as it's working on the cancer. However, when you get to a point where you progress enough, you have to switch treatments. And you pray to God that there's something that's going to be there when that happens. I initially started on endocrine therapy, which is an estrogen suppressant therapy. And eventually I became resistant to that medication. Even when I was on a PARP inhibitor, because I had the BRCA2 mutation, this drug targets that mutation. Within 3 months, I became resistant to PARP inhibitors. And it also eventually had gone to my brain this past year in May. So finding drugs that cross the blood-brain barrier, because not all drugs do. And what does it look like if you have to go in for brain radiation and all of this other stress and, dealing with that on top of COVID and hearing that you have progression in a room by yourself and not having that treatment partner beside you to help make those decisions with you. It's a very lonely, it's a very scary process. We rely a lot on clinical trials because those are going to give us the new, most up-to-date treatment options. But you got to think, when it comes to clinical trials, a lot of that is really based on privilege of your zip code. Because if you're in a community setting, if you can't get to the spot that has that clinical trial, you're not going to get the drug. There's some clinical trials because of COVID that have reduced the number of sites that they're being done at. Like here in Ohio, there might be something at Cleveland Clinic that is not offered in Columbus. And do I have the energy to drive 3 hours to go get this treatment once a week? When I was prescribed that first medication, there's a thing called step therapy. And a lot of states have this, is, when you're prescribed a drug, the insurance company can say, we're not going to pay for that drug until you've tried this cheaper drug and failed on it before we pay for the next one. And a lot of times what happens is when you're on that initial drug, you might build up a resistance to that drug that would have worked for you and been a better option. We're working in certain states. Ohio just made that practice illegal. They can't do that in my state anymore. We passed it last week, so I'm very happy about that. But, the majority of states, still allow step therapy practices to happen, and patients are being mandated to try drugs that aren't as effective as the ones that their oncologists are prescribing for them. It's very scary as a metastatic patient. There's a lot of things that go into this based on, what mutations you have, what you have access to, whether it's your zip code or your insurance. Because another thing is, if the best treatment for me is in Boston, I have Medicaid in Ohio. Ohio Medicaid isn't going to pay for me to go to Boston to get a treatment. I have to do a treatment here in Ohio. So for a lot of us, our zip code is really dictating our treatments. But at the end of the day, I have to hope and pray that research is going to provide that next treatment for me to go to. Realistically, most patients don't get past 5, and I'm on 9. I'm on number 9. I'm very lucky. I'm very blessed that I've responded, and that I have a researcher who is my doctor that relies on things like liquid biopsies and genomic testing to look at how the tumor DNA is changing over time and what we can target. But eventually I'm going to run out of treatments. And that's the sad reality of this disease, is science is not keeping up with the cancer. It's not patients who fail, it's science that failed us, and science that didn't keep up with our disease. So I know that there's a lot of patients who feel like they're blaming themselves, or they're failing on this disease, or they're not fighting hard enough. It has nothing to do with that. It has to do with the fact that our bodies are constantly evolving. They're mutating around this, and our cancer is mutating around this. And we need to have newer and better drugs so we can live longer lives.
I know that being an early stager, which I was, still am, you want to hear that you're going to be okay. You have a 6-month treatment plan, or 9 months, whatever it is, then you're done. You have that goal in mind. And for a patient like Tori, who's metastatic, her treatment journey will never be over. But I find that in the community, there's this gap between the women who are patients who are metastatic and those who are early stagers. They're terrified of talking. Sometimes the patient who's stage 1 or 0 doesn't want to hear about the patient that's metastatic because she doesn't want to be that girl. And then the patient who's metastatic says, well, you have it good. And there's been a lot of rift in the community with the different stages. But I find that the more we communicate about where we are, the better we can be in terms of advocates for all of our sisters. If you were Nadia at her stage, what would you tell her in a quick sentence that you wish she should know now, and to be her best advocate and be vigilant about her breast health?
I would say, first off, your feelings are valid. And just because your cancer isn't terminal doesn't mean it's not scary as hell. And take care of your mental health. And if you don't feel like you're getting the best care, speak up. And I think it's when we're oppressed to not speak up for ourselves a lot of times. So speak up, take care of your mental health, and know that your journey is as valid as mine as a metastatic patient.
Thank you, Tori. Nadia, what would you like to know about Tori's journey, and how do you feel that learning about her journey, hearing all you heard today, how has that empowered you, and what has it taught you?
Meeting people like Tori has empowered me to want to stand in the gap. So I know that I was an early stager, and yes, I did have this defined treatment plan, but the mental aspect goes on. I have to continue the mental health aspect of it every day, but want her to know that, all the work that they're doing in the fight isn't in vain, because you have those early stagers like me that want to stand in the gap, and still research and spread the knowledge and the education and do more for those stage 4 patients.
Thank you, Nadia. Ines, in your role, how do you think that you can make a difference for patients who are coming into your hospital setting or wherever you are, who are fearful of what's going to happen, to get them to be fearless and living in their true advocacy warrior state?
The biggest thing we can do for ourselves, I think, is to own our diagnosis and understand exactly who our enemy is, what our pathology report is. In this case, knowledge is power. And for me, imparting knowledge is my life's work. I feel like every woman that I can educate will educate someone else. And this is one of those sisterhoods you never really wanted to join, but once you're here, it is the most amazing community. And that is what I want to be part of. I'm an oncology nurse, but first and foremost, I'm a breast cancer survivor. And I need to help as many women as possible. That makes me get up in the morning and gives my life significance.
Beautiful, thank you. And Edwina, you help patients go into the same space from being fearful into fearlessness. In the space of this conversation, being that we're on Breathe TV, your role in a sense is helping patients to breathe throughout their journey, and to come when they come to you, they're in a state of shock, they're overwhelmed, they can't think straight, they're breathing in their chest space, not their lower abdomen space, because they're just in that adrenal overwhelm, right? How do you help them go from being terrified to leaving your space feeling like, okay, I can do this, I am not alone, and I have support throughout this journey, and I can breathe.
The way that I help women is I share my experience with them, and I walk them through my personal experience with the disease. I share every single step, and I tell them, listen, I'm 5 years in, and I'm still here, and I'm healthy, and everything is going well. And it was a hard, it was a really tough thing to do, but at the end of the day, you can do it. I was a super scared person before. Like I was, I can't believe that I got through this as well as I did. And I share that with them. And I tell them, you have nothing to lose. Just go through the motions of treatment and you have nothing to lose.
I was diagnosed in Mexico, actually. At that point, I just didn't research enough. And I had the surgery before the chemo. Had I done the chemo before the surgery, maybe my surgery would have been less aggressive. It's important when you get diagnosed, when you first get diagnosed, that you establish a really comfortable relationship with your doctor. If you do not have a comfortable relationship with your doctor, it is going to be a very difficult process. You need to trust your doctor. You need to feel like you can talk to your doctor about everything that you're feeling, about everything that you're fearing, so that your doctor can walk you through, if you're a young woman, maybe you need to talk about, saving your ovaries, going through IVF first. You need to feel comfortable with your doctors. Otherwise, you're just like standing there waiting for everything to happen to you. Like you need to get involved with your treatment and with your process and with your disease, so that you can understand every step of the way what is happening. No two cancers are alike. So your treatment was not the same as my treatment. Everybody thinks that, you're just going to do the same. Like this person had to do all these things, so you too. There's a lot of women who don't have to go through all the motions that I had to go through, whose treatment lasts 6 months. Mine lasted 3 years. I'm still in treatment. I'm still taking, pills. And I'm going to take them for 10 years. And you have to, in order to understand why you have to go through 10 years of treatment and not be like, oh my God, what do you mean 10 years? And not be completely freaked out by what you're hearing, you need to educate yourself. And you need to know why. And you need to understand that, yes, side effects are always, every time you take a drug, you're going to have a side effect. But side effects do get better with time, or with, or with tweaks to your diet or exercise, or, there's so many things that you can do that include, your spirituality and how you communicate with your friends and family, and communicating with your work. If you're stressed out about, work, you need to be able to communicate with your work about what you're going through and how you're feeling. You need to find a way to include everything so that you can come out of it, victorious. And for that, I also, one of the things that I recommend to women is, if you're feeling overwhelmed, seek mental health help, because it is a difficult time in your life, and most likely you're going to be experiencing a lot of feelings that you've never had before, and that you probably need a therapist who can help you through it. I wish that somebody had told me to seek help early.
Yeah, to your point, it's very personal for each of us. Tori's journey is very different from Nadia's, and yours is different from, Ines's, and we have different roles to play as well. But what I've gotten out of this conversation is it's important to talk and to connect as sisters, because we're in this together. Every patient's journey will be that person's journey, not you're really a person first before you're a patient. And also, I've seen the love in all of your faces, and I've gotten to know you all throughout this time. And I think that we can't forget that it's all about heart center first, and it's about having our faith, and it's about walking together as sisters, hand in hands, hearts joined, and committed to supporting each other throughout that journey. And for those who are watching Breathe TV, I want to thank you for watching this first episode. You come to a space today where you can exhale and learn more about breast cancer, about treatments, about trials, about the journey, about being human, and about honoring your body, your mind, body, and soul going through this breast cancer journey and through your journey as a human being. And so thanks for being here. I'm Maimah. I am your host, and I will see you next time on Breathe TV. Thank you.